Great. Well, okay, I think we've caught up on time here, so we'll move on to our next presenter, Mary Beth Mudd, who's going to talk about evaluation of a single treatment of mechanical dermal microcoring for skin laxity, texture, and wrinkles of the neck.
Good morning, everybody. Can you hear me? Okay, great. So I have no disclosures. So microcoring technology, or MCT, is FDA approved currently for moderate to severe wrinkles of the mid and lower face. MCT uses hollow needles to mechanically remove tiny microcores of skin, less than 0.5 millimeter diameter without scarring. There's no heat or scalpels used. This allows skin tightening and reduction and removal of wrinkles, also resulting in improved skin texture. Pathology specimens have also showed increased collagen production. So this was an off-label study to assess the efficacy of a single MCT treatment to improve skin laxity, texture, and wrinkles of the neck. So this was a prospective single-center study of my first 21 patients that I used MCT on the neck. 100% were female with a median age of 64, ranging from 50 to 76. All patients were skin types 2 through 4. 2 patients previously had surgical facelifts and neck lifts done 4 years prior to the MCT. 5 patients had had previous face tight treatment done by myself, while 3 patients had had previous face tight as well as my Elevate suture suspension done by myself. Of the 21 patients, 17 of them had both neck and face, and 4 had just the neck treated. We used tumescent anesthesia in the neck unless they had just a neck treatment because of lidocaine issues. Density was generally 5%, although 2 patients were partially treated at 7%. Needle depth was commonly used at 3.5 to 4 millimeters, but ranged from 3 to 4. You'll see that the core count significantly increased after my training. Training day, the full neck was 1854, and then I started taking more cores out, thinking I would get better results, with a median of 5470. Patients were rechecked at 4 days, 1 month, 2 months, and 3 months post. So each patient completed 3 months of standardized photos, which were reviewed independently by 2 reviewers. We assessed skin laxity, texture, wrinkles, and necklace lines. And you can see that the vast majority of patients had mild to moderate improvement in their texture, skin laxity, and neck wrinkles. Some patients had an excellent result, and there were patients who did not show any improvement. So observations were that I felt that patients generally tolerated the treatment well. We had only 1 patient who requested early termination of her neck MCT. Technically, it is much more difficult to perform neck MCT rather than facial MCT. This is because there's usually more skin laxity of the neck as well as the neck anatomy with bones, and we got a lot of inappropriate needle alert notifications. The neck tissues do seem to heal more quickly, though, than the treated facial areas. Side effects included occasional ecchymoses, which were actually secondary to the anesthesia injections, as well as mild swelling. But in general, the patients had less transient erythema on the necks when compared to faces. We had 1 patient who experienced moderate erythema and some localized induration in about a dime-sized area. It was treated appropriately and resolved without problems. There were no other adverse reactions, including scarring. Patients were consistently able to resume their usual skincare and activities after their day 4 recheck. Their satisfaction with the treatment experience as well as the downtime was very high, and we have many patients who are considering a second treatment. Several patients felt that their visual results were better than their photographic results, and even the reviewers felt the same thing. The amount of perceived visual and photographic improvement following neck MCT definitely correlated to the pre-procedural skin condition, especially with laxity and textural irregularities. And interestingly, all the patients with previous surgical or minimally invasive procedures had mild to moderate improvement. So this was the first patient that I treated on her neck, 70 years old. We treated both face and neck. You can see her core count and her depth. And what I really noticed on this patient, she had actually had a previous facelift and neck lift 4 years previously and was very unhappy with her neck results. Well, we were able to improve her jawline, improve the laxity and the texture. The anterior folds or skin excess in the anterior neck also improved. So she was generally very, very happy with her laxity, wrinkles, and her texture. This patient was 70 years old. She had face and neck done. Again, you can see that she's got improvement in her anterior neck folds, her texture's improved, her wrinkles have improved. This is a 56-year-old, again, face and neck, cores and depth are noted, but the interesting part with her, she really noticed a significant improvement in her cervical mental angle. This was a 76-year-old, again, face and neck at 3 months follow-up. And she was a patient who really hated downtime but was willing to try this. You can see her core count and depth, but she got significant improvement along her jawline. She got the jawline got better, significant improvement as far as her neck laxity, the wrinkles, and the texture. So in conclusion, MCT is a safe and effective treatment option to improve skin laxity, texture, and wrinkles on the neck. I do think that further study is needed to determine the optimal number of treatments as well as the density, depth, and number of microcores to be removed for best results. And I also think that it would be interesting to further study whether this could be combined with energy-based devices to achieve more dramatic results in patients, because our patients don't typically want surgery. They want to have a non-surgical. This again was the first patient we treated on the neck. On the left is the first photograph that I had taken of her, which was 1 year, 2 months, and 2 days prior to the second photograph. She was very unhappy with the results from her face and neck lift, but between some Botox, a couple of syringes of filler, a combo of Halo and Moxie laser, and then her Ellacor of the face and neck, you can see that she looks significantly younger, and she's now very happy with the way her neck looks. Thank you for your attention.